Hello, everybody. This is the Hobby Hour for the month of March. My name's Kirk Watson. I'm the founding dean of the Hobby School of Public Affairs, and we're very pleased that you would join us. Of course, March is Women's History Month. And as part of Women's History Month at the Hobby School of Public Affairs at the University of Houston, we're celebrating that month by honoring and looking to many of the women who have made history in Texas. And today's Hobby Hour is one that I'm particularly pleased about because two of my longtime friends are a part of this Women's History Month Hobby Hour. We have two members of the Texas House of Representatives with us. They are the longest serving Democratic woman in the Texas House of Representatives. She has the greatest seniority of all of the women in the Texas House and all of the African Americans that have served in the Texas House. And we have the longest serving, highest seniority Republican woman that serves in the Texas House. And they're both, like I say, old friends of mine or good friends of mine. And I've enjoyed getting to be their friends over the years. So let me introduce them. First, the Democrat, Representative Senfronia Thompson. As I pointed out, she is the longest serving Democrat in the Texas House. Her first session was in 1973. She has served, as I pointed out, longer than any other woman or African American in Texas history. She represents House District 141, which includes Northeast Houston and Humble. She's chair of the Licensing and Administrative Procedures Committee, and she sits on the Redistricting and Business and Industry Committees. She's the author of Texas's first ever alimony law, the James Byrd Jr. Hate Crimes Act, laws banning racial profiling, the state's current minimum wage law, laws creating drug courts, the contraceptive parity law, and on and on. Scores of reforms benefiting women, children, the elderly, and Texans generally. We're also joined by Representative Geanie Morrison. Representative Morrison, as I pointed out, is the longest serving Republican woman in the Texas House. Her first session was the 76th legislative session in 1999. She is from Victoria. She represents House District 30, which is, as I indicated, a South Texas district, including several counties, Aransas, Calhoun, DeWitt, Goliad, Refugio, and Victoria counties. She sits on the Appropriations Committee, the Appropriations Article 3 Subcommittee, the Environmental Regulation Committee, and the Redistricting Committee as well. She's been a leader on higher education issues and has been named Legislator of the Year by the Texas Community College Teachers Association and the Texas Association of Student Financial Aid Administrators. And prior to her running for state representative, she served on the governor's staff as the executive director of the Governor's Commission for Women that also housed volunteerism. So we're really fortunate, and I want to say welcome to both of you, and thank you for being with us today. Ms. T, I'd like to start with you. Well, I'll start with a little bit of history. First of all, as I pointed out, you were elected first in 1972. Your first session began in January of 73. Representative Morrison was elected in 98. Her first session was in 99. That means that you've served 48 years roughly. Representative Morrison has served 22 years. And in the 2021 87th legislative session, there are still only 38 women out of 150 members, which is a roughly 25%. How many women were there in 1973 when you first came in, Ms. T?
There were only 5 women in the House and 1 in the Senate. And you have to recognize the backdrop during that era.
Please.
Sissy Farenthold, I guess not the first time, but she ran for governor. And she had been the only woman in the Texas legislature during her tenure. Equal rights amendment was being trying to be passed around the country. Women wanted their equal rights. Abortion was in the Supreme Court, and it was about to be heard. The arguments of the United States Supreme Court, Roe versus Wade.
Yeah.
And women were beginning to feel like they had something to offer. They could bring something else to the table other than just total policy, policy, policy. They can do policy as well as bring some other things to the table that maybe men couldn't bring. And it was a society was a little reluctant to elect women during that time, but they took a chance on a lot of them. And I got elected along with Kay Baylor Hutchinson was in my class, Sarah Whittington was in my class, Chris Miller from Fort Worth was in my class, and Congresswoman Eddie Bernice Johnson was in my class. And you may remember my class was probably one of the largest classes that came, was about 76 or 77 of us because of the Sharpstown scandal.
Mm-hmm.
We had that big reform we came in. You know, we was going to turn Texas over. We was going to change everything all in one session because we were new and we didn't even know we had enough people in our freshman class to elect our own speaker.
Wow.
And it was difficult because men were not used to working with women. As a matter of fact, when I first had my first session, I had one of my colleagues call me his beautiful black mistress. He thought it was funny, but I gave a personal privilege speech on the floor that got recorded in a history book, Texas history book, and it still is in that book to this day. Because in his culture, he didn't recognize. To him, it was just he was trying to. I think he was trying to compliment me, but in my culture, it was really putting me down on the low level of a prostitute, of a tramp. And I was offended because of the fact that I had gotten elected just like him. And it was not easy. I got threatened, Geanie. Dean, I got threatened. People told me, said, "Oh, Senfronia, don't make that personal privilege speech. If you do that, you're gonna get all your legislation. You're gonna get killed. People are not gonna support you. You're gonna alienate yourself from your colleagues here." And I had to sit down and weigh what was the best. And I made a decision that I was going to do that because I needed to let people know I had gotten elected. I should be respected, regardless of my ethnicity or my gender. And my poor husband just knew between Austin and Houston that I was probably gonna get killed, and he probably never see me again because I was so outspoken at that time.
My goodness. Representative Morrison, you came in 99.
Mhm.
Talk a little bit about how, well, first of all, how many women were in the House when you came in the House in 99?
There were actually 29, and then Myra Crownover was elected when her husband Ronnie passed away. So that
Right.
was 30. So there were 30. There were actually 11 Republican women at that time in the House. And so, yeah, so getting elected 98 and then taking my first session in 1999, of course, the Pete Laney was the speaker, Democrat speaker, and serving under him. And we had, a good group of women that were involved in what was going on in the House. And those first two sessions, as we all know, that they're learning sessions. And so, but I felt very welcome and accepted in the Texas House. The women were great to all, immediately come in. There were three of us in my class originally till Myra came in. So there were three women that came in 1998, were elected in 98. And then Myra made the fourth when she took Ronnie's place after Ronnie passed away. So I felt very well welcomed, very part of what was going on, and I was serving on committees that I was really interested in. That Speaker Laney had put me on. I'd asked for higher ed, and I was on higher ed, and I was working on juvenile justice and family issues, that committee also. Amarin Hale was the chair of higher ed, and she took me under her wing because I was very interested, and we became fast friends. And I just felt very welcomed by all the women, R's and D's, and never felt issues with working with the men either. Senfronia had taken care of that by the time we got there. But no, very, very welcomed. And it was a great session. And I mean, voted no a lot, but that's just the way it was. But enjoyed the session and learned a lot. Those first two sessions in particular, learning the ropes and learning how to work with people, but met a lot of people that just took you under your wing and helped. It was a great experience.
So, and Ms. T kind of talked about this to some degree about, but I don't want to presuppose changes.
Sure.
But to the from your perspective, Representative Morrison, did the first of all, there were 30 when, as I understand what you just said, 30 women that were there when Representative Crownover came in. So, and there are only 38 today, 38 women out of 150 after, more than 20 years, 22 years, I guess. But have there been significant changes for women serving as members of the House in your 22 years?
Yes, I think so. There were 11 Republican women. There are only 7 now. And we only had 6 the last 2 legislative sessions. There are quite a few Democrat women that have been elected the last 2 election cycles. And so I've been trying to really encourage women to run. But I think there really there have been a lot of women in leadership positions. When I came in and when Speaker Craddock was elected, the first Republican speaker, he had a lot of women in chairmanships and working together. And they were great mentors and really enjoyed working with them. That's when I chaired higher education too for 3 legislative sessions. But I think there have been, I've never felt during my time that women were not equals. I really feel that the men feel like we work really hard and a lot of times work harder than they do because we're always trying to make sure that we're very informed and know what's happening. And I have felt like that they have really enjoyed our leadership positions because we are always very well prepared. So I have felt that women have had great leadership opportunities. We just need more women. I mean, if you look at the numbers of voting, more women vote than men. And so I think traditionally we should really have more women that are involved in the Texas House.
Ms. Thompson, Representative Thompson, tell us what you think about the changes now. You've talked a little bit about that already, but give us a little more of your feeling about what's changed since, I mean, goodness gracious, since 1973.
I think women have been able to prove to society that they have more to offer than cooking a cake and cookies. And when we come to the legislature, we work on issues that impact families, issues that impact healthcare, issues that impact education, issues that impact good job opportunities. And I think that the vantage point of being a woman and coming with the experience of a wife, a mother, or a female adds to our opportunity of in working with our male counterparts. And one of the things that I have learned, and Geanie and I can attest to this because we've been friends since she arrived in '99. We really work on issues. And we have found that if you stick to the issues and put the partisan politics aside, you can accomplish a lot in trying to resolve problems that face society. There are some systemic problems. I thought when I first came, my first session, that we were going to be able to solve them all in one session. Unfortunately, those problems takes a whole lot of time. And it's not because we want to take the time. Each problem presents a subset of that problem, and that subset present other subsets. And all of those things, looking at a problem and trying to work out a solution in an integrated approach to a solution has been something that we have been working toward. It looks like a lot of times we're moving slow, like a snail's pace, but it's not that. That problem has so many tentacles to it. We have to resolve those tentacles before we can finally get to the main part of that problem. as they say, you know, you can't eat a whole elephant at one time, but you got to take one bite at a time. And a lot of times on legislation, that's what we do.
Well, let me ask you. Let's move to legislation as you talk about, as both of you talk about that. Let's talk about some of that legislation. And I guess the first bit of legislation I'd like to visit with is, I'll start with Representative Morrison. You filed HB 3423, and that is a bill that, if you're like I was when I was in the legislature, I never remembered the number. Somebody could come
No,
up,
never.
somebody could come up and say, now tell me about Senate Bill 299, and I'd say, you got to tell me what it's about.
Right, exactly.
Yeah. But I've got 3423 written down here. That's the only reason I know that. But it requires that certain health benefit plans provide coverage for supplemental 2 or 3 dimensional breast ultrasound imaging as part of the annual screening that would be covered under the plan if a licensed healthcare professional finds the enrollee has a certain type of dense breast tissue when they're screening for breast cancer. Talk a little bit about that piece of legislation specifically, but also the context that Representative Thompson was just talking about, that the need to concentrate on something like that, and it take more than one session sometimes to pass something because related to particularly women's health, and I know that to be a fact. But so talk a little bit about that piece of legislation.
Sure. Well, and this is one of those instances that I tell people one person can make such a difference, because this is actually a piece of legislation that was brought to me by the wife of the physician that I go to for my mammograms.
Sure.
And this is something that working with her husband and seeing what's going on with women's health, the 3D imaging is very new, as we all know, but it shows a lot more definition. And so it's basically it's something that she brought that we worked on. And as you say, you know, the issue on something like this, as Senfronia said, may take several sessions because it's something that is very important, but it also has a cost to it. And, you know, a lot of times when you get to insurance and more cost, you know, it takes a while to get there. But it's something very important, because if a woman is diagnosed and with breast cancer or looks like she might have breast cancer, this 3D imaging, the new imaging, shows you so much more of what's going on, but it's very expensive. I mean, in my family, you know, I have seen that sometimes someone will say, no, I just can't afford that extra cost. And so maybe I'm not going to do that at this time unless you really think I need to. So it's one of those health issues that needs to be addressed. And it's something that we're going to see more and more of as women that need to have more in-depth, that they do have something that looks like it could be breast cancer, that we work on. But like Senfronia said, this may not be something that happens this session, but it's something that definitely needs to be brought to the forefront and talked about what's going on with these images, just like any other health issue that comes up. And when you have better ways to look at it, you look at ways that will help women in their diagnosis.
Yeah. Now I know this session is just feeling like it's kind of starting to roll because of the pandemic and all that. So has this bill been set for a hearing? What's the status of that legislation?
No, it has not been set yet. As you said, things have been running, you know, a little more slowly because of all the issues that have cropped up recently. So bills are getting set now. We are starting to have hearings with bills in committees. And so hopefully it will be set before too long so that we can discuss this very important women's health issue.
Yeah, great. I hope so. Ms. T, you filed House Bill 107, and that's a bill that would extend Medicaid health insurance for new mothers from 60 days to 1 year after pregnancy. And that would implement the #1 recommendation of the Texas Maternal Mortality and Morbidity Review Committee. And I remember, like 3 sessions ago when this data was, I was on Health and Human Services in the Senate, and we were talking about this specific data. Can you describe why this legislation is so important, and what the findings were about the difference between 60 days and 1 year. And yet here we are still addressing this issue.
You know, one of the things that I have noticed since I've been a member of the legislature, when things impact women and women's health, it looks like it takes longer. And I want to answer your question, but let me just give an example of why I say it takes longer. I think Geanie was probably a member of the legislature when this happened. When Viagra came out, we passed no legislation. The insurance companies immediately added it for coverage, but we had to pass a law for women to have contraceptives, to stop redlining in the bedroom. And contraceptives is used more than just preventing pregnancy. It's used for a whole lot of other things that doctors use to treat women for conditions that they have. When we go back to House Bill 107, let me tell you, the poster child is Andrea Yates. You may recall she's the lady that killed her 5 children. And we believe that had she had an opportunity to receive postpartum depression treatment, that perhaps the 5 children may be alive today and she would not be in prison as an inmate. And what we know that some women who may suffer from this condition may need a couple of days of treatment, but some may need more than 60 days. And we want to give them a window, not just a 60-day window, but a 12-month window. So there are opportunities for these treatments to take place. Why is this important? It's important for the health of the mother, the family, and the children or the child. And we want to make sure that we provide those opportunities for those persons who need a little more than 60 days of treatment. And that's what this particular bill does. It gives that opportunity to those patients who may need it.
In my memory, and I may have this off a little bit, but my memory was when we first were looking at that data 6 years ago or whenever it was, and I apologize, I don't remember precisely.
It was a select committee.
Yeah, but I remember that part of that information and data said that it was after 60 days that you saw the biggest increase in suicide rates
Right.
for postpartum.
Right.
Yeah.
Because a lot of times it doesn't show up within the first 60 days.
Right.
But it may on the 7th day.
Yeah.
There's no treatment available.
So has that bill? And again, I know that we're just kind of catching up and
Yes.
in the session, but has that bill been set for a hearing, or is that a hearing?
No, it has not, and I anticipate that it will. The pandemic has really set us back, and then the freeze has set us back even further. And we're trying to play catch up on all of those.
Yeah, I know.
All of those areas.
Yeah, I was talking to Representative Morrison earlier, and we were talking about how everybody thought they knew what the session was going to kind of look like with the pandemic, and then the freeze caused it to shift completely. Let me shift gears a little bit and talk about some other legislation that the two of y'all are working on, important legislation. And I'll start with you this time, Ms. T. You're carrying what's known as the George Floyd Act in the House.
Yes.
HB 88. Talk a little bit about that bill, but I would also be interested, and I think others would be, in your perspective on how what the intersection between racial justice and gender equity and your expectations for legislation like that. And as I ask you that question, I'm gonna plug something. The Hobby School did a survey, and we found in that statewide survey that the Hobby School did, that the George Floyd Act, that criminal justice reform, was supported by 72% of Texans, with 52% strongly supporting it. And I just, for those that want to keep up on data that are related to certain things that are going on legislatively, we're doing quite a bit of that at the Hobby School. But talk a little bit about the bill you have filed.
Well, first of all, I want to say that many years ago, during my tenure, we established what was called the Sunset Commission, and that is a commission here or a committee within our body. And what we do, we have an opportunity to review agencies. We want to make sure that they are fulfilling the expectation of the policies that has been established for those agencies. What are the best practice? Are they following the best practice? And what kind of improvements are that they need to make within that particular agency? We have over 300 agencies within the state of Texas, and we give them a review every 12 years. And we are trying to review the law enforcement area. No agency exists that does not need some improvement, some tweaks, some changes. And the George Floyd Act has about 7 different components. It has qualified immunity, which I would like to eliminate. And here's what qualified immunity does. It is a rule that was established by the Supreme Court of the United States in 1871. And this was the protection of slaves against the Ku Klux Klans. They freely had been freed, and they was kind of rounding them up and putting them back in slavery in some of the southern states. And later on, it morphed into other things. It gives a person as some people say, a free pass in this respect. In order for you to be able to prevail in court on qualified immunity, you must find an exact duplicate case with the same set of facts that the court has ruled upon in favor of the petitioner. And there are no such cases. So number one, you have a Herculean task. So why have a Herculean task if it's unreachable? And secondly, chokeholds have become a real problem. And then we have, it has de-escalation. I know a lot of time police officers go up on the scenes and they find all kinds of conduct going on, but we just don't want them to exacerbate the situation when they go up on it. And then we want excessive force. Police officers are never, ever charged or held accountable for excessive force. And then we have a matrix. If cities want to hire someone who has been a bad actor on one municipality, then they know what they are solving. And finally, we have Class C misdemeanors. We just don't want to fill our jails up with people who runs a traffic sign and didn't call in the accident and they could just got a ticket. You know, why stack them in jail and then you got a rapist over here, you don't even have a place to put him. You know, you got to hold him in a holding cell because you got your jail filled up with Class C misdemeanor cases. It's not an attempt to minimize the importance of police officers, because we know how important they are in our society. And it is to give them better tools to look at these agencies and to be able to implement best practices in these areas. Should they be paid? It has nothing to do with funding. I don't think they're paid enough money. I wouldn't be a police officer because somebody's asking me to put my life on the line to save theirs. I said, no, not enough money in the world for that. But those persons who do it, we want to make sure that they are well paid, that they are protected, that they are accountable for their conduct, just like everybody else. And we want to make sure that we put them in a working environment that is a benefit not only to them, but to society. And when they leave home for their tour of duty, we want to make sure that they're able to return back to their families. That's what the George Floyd Act does.
Appreciate that answer. Thank you.
You're welcome.
Representative Morrison, I want to come to you and ask you a little bit about your work on the Article 3 subcommittee in the House. And I realize as that came out of my mouth, I'm doing something I promised I wouldn't do as the moderator of these things, and that is talk in the jargon of the legislature, right? Article 3, like everybody knows what that is. Would you, that's important, that is important work. Would you describe what Article 3 is, the work, and you've got history with this. In fact, you and I have, that's somewhat where we first started doing a lot of talking to each other and working with each other is related to this. So could you describe what it is you're hoping to see this session?
Sure. Well, of course, as you're saying, Senator Watson. We worked a lot on higher education issues when I chaired the Higher Education Committee in 03, 5, and 7. And working on the Appropriations Article 3, of course, Article 3 includes public education and higher education. But as you know, most of what goes on with public education is actually legislation, and we passed the large rewrite of how we fund our schools and what we do legislatively last session. And so the major part this session for public education is to make sure that we fund it and keep the funding going.
Can
Higher
I,
education,
can I
yes,
interrupt you there?
sure.
Because I was going to ask you that question since you brought it up. When HB3, which was that transformational public education finance bill that you just made reference to from last session, when that was passed, a lot of folks were worried about whether or not the commitment to keeping that funding would be there. Can you give us a little bit of your view on how you feel like that commitment's going to happen this session, including with money that may be coming from the federal government to help because as a result of the pandemic?
Yes, and you're absolutely right. The huge commitment is to make sure we fully fund what we did, and we've all been worried about it because of what's happened in the last year with revenues down. That has been a big concern, and as you're talking about too, with the stimulus money that has come down, there are areas that some of that money can be used for education. Of course, the most recent one, we don't know when the state will actually get any part of that money, but that's been the hardest thing, is to look and see. But I think we will be able to fully fund it, even with our revenues down, because of what we do have to work with from the federal government also. And so I feel confident that we will be able to fully fund public education. The heartache for me and others is, we have not really done a lot in higher education for several sessions because we've been working on public education. And this legislative session, the hope was it was going to be the higher education session that we went in and really worked on higher education, made some changes and help with the direction it was going, and look at the formula funding and everything. And sadly, with what happened with COVID and then the pandemic and where we are, it's just been put on the back burner once again, which is very disturbing to me because, as you know, higher education is what I'm so passionate about, because anyone can have a better life because continuing on their education, whether it's, a degree or if it's an associate's degree or a certificate. I mean, just all forms of higher education help for better jobs and better education. And so looking at that, in Article 3, of the appropriations, when we're looking at higher education funding, we're looking, of course, at the formula funding and how that works. But also, as you know, each institution has different issues. And what we're really looking at this time is also looking at those institutions that are the smaller institutions that are really affecting the lives of the students that cannot afford to go to a large four-year institution, or possibly may not be able to get into that institution without other means. And so we're really looking at those institutions that are really helping our whole universe of students come in that are closer, and their cost is not as much. Of course, sometimes they aren't able to offer as much, but looking at helping to make sure those institutions receive funding and also get what they need to continue on with educating the students that we need to educate, and also are historically also schools that are helping our population of undereducated, or our population of minority students that are minority majority now. And so we're really working that those smaller institutions are receiving the funding, because the programs that they're doing are phenomenal and bringing our students into higher education.
I agree. And from, but give an example so that those that are watching will know what it is you're talking about that help with that flow, so that students that have, frankly, less opportunity, we would create better opportunity.
Right. And, looking at, I mean, I'll give an example in my community, University of Houston, Victoria.
Right.
We were a, upper level division for many years. We only had juniors and seniors until we did downward expansion several years ago. And so now it's a 4-year institution. And so what we've been working on for many years is to make sure that we could have a campus that students actually could come there, live there, have a 4-year experience. And so, I mean, it is a majority minority institution that is in the area where, there's not another higher education institution of 4 years for 100 miles radius. I mean, since we're in the crossroads, you have to go to Houston or Austin, San Antonio, or Corpus for that experience. And so we're reaching out students in that general area that cannot afford to go off to school, but could come to Victoria and but also have dorms, on-campus life, expansion. UHV is expanding a lot and trying to make that experience of students that are actually living on campus and being students that are coming to university, but also helping to educate students that may not have an opportunity to go someplace else. It's a great bargain price-wise, but yet they get that full experience. And so those are the type of schools that may be smaller schools that do not receive the enough funding to do the things that they want, that we're really looking at those and trying to help them come together. And of course, a lot of them are in rural areas also, not all, but a lot are, but just making sure that we have access for all of our students. And because we know with what's coming to Texas, I mean, we have to have the educated workforce or we're not going to continue to grow like we are right now. We have to provide the jobs, but the skills to go into those good jobs.
Thank you for that. As we kind of come to the end of this, one of the things that I thought I would do is go back to something that Representative Morrison brought up earlier. And again, I want to remind everybody that, this is Women's History Month, and these are two women that have made, I mean, they are historical in a positive way, is the way I said it earlier to both of them. But Ms. Thompson, I want to start with you and kind of follow up on something that she said. And what I'd like to ask both of you is, what advice do you have for women wanting to be involved in public policy? Maybe running for office, maybe running for the House, as we've talked about, but maybe not. But and I'll start with you, Ms. Thompson. What advice do you have based upon your history and experience?
Well, naturally, we would like to see more women in the legislature, but there are so many committees and so many positions within the community that women can really make a difference. Like we need women to be more concerned about better early childhood education, mental health care, women who are concerned more about things that of how we get our kids better educated, the quality of life, healthcare issues. And there are so many committees that women can be a part of and make a great contribution. If they want to run for office, they need to know what are those requirements. Just because they're a woman and running is not enough. What are you going to bring to the table? And they also need to be mindful of the fact that running for office is a very expensive and costly process. This is not to deter anyone from running, but it when they sort of put their name on the line, sometimes they feel like that once I file, money's just going to come from me from all sources. But you and I and Geanie, too, it doesn't happen that way. People want to know, what are you able to do? And if you just say, well, I'm going to just be another woman in the legislature so we'll have a larger number, that's not enough. what are you going to bring to the table that's going to improve the life and lot of society as a whole, not just yourself, but society as a whole?
Representative Morrison, what advice do you have for women that want to be involved in public policy and make a positive change?
Well, I agree with Senfronia. You know, the most important thing is get involved in your community. I was very involved in my community, volunteering in a lot of different aspects. One of the aspects that was near and dear to my heart in volunteering was working with teenage girls that were pregnant and making sure they finished school and helping them do that. And back in the time that we worked on that, Miss T, that was another one of those issues you didn't talk about. And there was a group of us that went from the junior league and said, you know, we need to do this. We need to make sure that these girls stay in school, get an education, but also help them with life. And that was one of those things that no one thought we could get it accomplished, and we did. But basically volunteering and working, as Senfronia said, I mean, women have a different perspective as your children are growing up and working through school. You see what's going on in the school situation. You look at problems that they're dealing with, and just getting involved in your community is the most important thing, I think. So you have a well-rounded experience to know when you step into a role that you can work on issues and work with other women on issues, which a lot of times, as Senfronia said, those are the hardest issues to get past, but also have the knowledge. So when you work with your colleagues, they know where you are. But I think the other thing is too, is just support other women. We do need more women represented in the Texas House, and supporting and being mentors with other women. The other thing is Senfronia said about the money part of it. I think it's so funny because most people think that we're in Congress and we're making a living wage, and no one knows it's a $600 a month before taxes. And so basically, I've always looked at being in the Texas House as continuing my volunteerism, because it is something that you're doing because you have a passion to help people. And you came into this role because I was drafted. I mean, I'd never planned on running for elected office. I was approached because of what my commitment and working in my community to run. But I think I look at it as continuing volunteerism and working on issues and problems that you can help with. And usually when constituents come to us, they have been through the whole gamut of trying to help themselves. And then it's very rewarding to know that you can help them try to find resolution. It may not be what they're looking for, but you can help them get down the road and try to resolve those issues. I know, as all of us that are legislators, you have to be a problem solver. And that's the thing, is working for your constituents. So just being a good mentor and getting involved in your community and knowing what the important issues are for you that you want to work on.
Well, I appreciate both of you giving those answers, and let me just say thank you not only for being on the Hobby Hour with us as part of Women's History Month, but thank you for all of your public service for all these years. For those watching and those that will watch this, because we're going to distribute it some to Ms. Thompson's had a great suggestion about distributing this, and we're going to be doing some of that as well. Folks, anybody watching this, you're hearing from two outstanding leaders, and we ought to all be thankful for the fact that they're doing that and providing that leadership. And I've certainly enjoyed their friendship and working with them over the years. I want to remind everybody that next month in April, on April 21st at noon, that'll be the next Hobby Hour. I'm going to be joined by my good friend and a U of H alum, the former United States Secretary of Education, Margaret Spellings, and some folks from Texas 2036. She's now the president and CEO of Texas 2036, and some folks from the Center for Houston's Future. We're going to be discussing a very compelling report that they just released that tackles the very vulnerable relationship between world oil and gas markets and public education funding in the state of Texas. We'll be posting details about all that on the Hobby School website and our social media channels, but it's April 21st at noon, and I want to encourage everybody to go ahead and mark your calendar so that you can be part of that. And with that, let me say one more time, thank you to our guests, Representative Senfronia Thompson and Representative Geanie Morrison, for being a part of the Hobby Hour and for their many, many years of wonderful public service. Good luck in the rest of this session, particularly as we've been talking, as it heats up and we go through May. God bless both of you. Thank you very much. And thanks everybody who are paying attention to the Hobby Hour.
Thank you. Thanks, Kirk.
Thank you so much. And I'm an alumna of U of H.
Oh, I should have pointed that out. I apologize. I should have done that.
Your comments,
Okay.
edited comments.
Yeah, that's right. Ms. Thompson, thank you very, very much. As
It was delightful.
I'm indebted to you. Geanie, the same to you. Thank you very much. Let me know anything I can do to be helpful to either one of y'all.
Thank you.
Thank you, Dean.
Really enjoyed it.
Bye-bye, everybody.
Bye.
Bye.